Good evening. Today we have our clinical psychologist, Megha Sharma, along with us to discuss and have an interactive discussion on depression. In a recent conversation with Vogue, Deepika Padukone opened up about her struggle with depression. You being an expertise in that field, what would you like to say about her journey?
Right. Thank you so much for that question. And yes, I'm very glad about how Deepika Padukone has been very open about her journey through depression, and her talking about it validates so many others who are actually going through this journey themselves. Right? So I feel like it's a very, very strong and a brave move by Deepika Padukone, and I think this is going to do the world and the society a lot good, than we can expect, or than what we have seen until now. Because unfortunately, there has also been a lot of stigma relating mental health, relating psychiatric setup, psychiatric hospitals, and also disorders particularly. So in that kind of setup, and especially in a setup where we're, coming from the Indian backdrop, it's very common to not understand the concepts very well and to not be very aware of the mental health disorders in details. Even today, many of the population is living in absence or living in ignorance, negligence about these things. So definitely Deepika Padukone coming up and talking about it on a national and international platform is a very, very bold move and a very beneficial move for the whole mental health industry.
And that was a very insightful answer. Thank you for that. Now let's talk about more about depression, right? Can you tell us more about some specific symptoms of depression?
Right. That's a very useful question, I'll say, and I'll be happy to elaborate on it. So basically, depression comes under something called mood disorder according to the diagnostic criteria. Now, as the word can imply, or let's say it can give you a rough impression that there includes sadness. So yes, sadness is a feature or a symptom of depression. There can be many other symptoms as well. I'll be happy to list a few of them here. So there can be low feeling, there can be this sinking feeling that you have in your chest, there can be chronic headaches sometimes related to it, not being able to sleep properly, not being able to get to sleep, waking up early in the morning, that kind of symptoms may be there. There may be difficulties in concentration, paying attention, being able to do work that you're supposed to do. There may be difficulties there may be features of procrastination. Like, you have to get this thing done. You should right now sit down and do the work, but you're just not able to do the work. I feel this is very, very relatable in a lot of cultural, corporate context. That yes, that the deadline is approaching, but you're just so stressed and so overwhelmed with so much going on that you're not able to function at your peak, at your best, performance. So that can also be a manifestation or a symptom of depression. Having said that, I think, I think one of two important things that's just coming up to my mind, I'll be happy to share, is numbness. Instead of feeling sadness, some people may also feel some numbness. So if by any chance someone is feeling like that, or someone is not feeling any emotion at all, someone may have a range of emotions where they can have weeping spells, like crying for no reason as well. So that's also, something that can be included, or that can, depression can manifest itself by those ways as well. So yeah, that can be there. I think I'll just say one thing before I can wrap up this particular question here. Is that please understand, this is for the common public, that please understand that someone may have everything that they're supposed to have. Someone may do very well in their career. Someone may do very well financially. They may have a very loving, supporting family, loving partner, children, etc. But still someone may go through depression. So let's understand that it's a disorder that doesn't pick and choose. right? So it's something that anybody can experience, and it doesn't need a logic to explain that why are you feeling sad about it. It doesn't work like that, right? I hope it helps people to understand this.
Yeah, that was definitely very informative. Thank you. Let's talk about types of depression, right? We have talked about symptoms. So how many types of depression exist, and can you go into further detail on each of them?
Right. I'll try to, of course, give you a brief overview of all of how that happens. So, like I mentioned previously, the depression is a type of mood disorder. There can be a few types of depressions. There can be short term, or let's say short lived, like, look, let's say for the last 15 days you've been feeling extremely low, extremely dysfunctional, not being able to come out of bed, etc. Lots of weeping spells, lots of hours and hours of crying. It can range from a picture or an episode like that to, let's say, a scenario where, let's say, someone is experiencing low mood constantly for the last 2-3 years or more or less, right? So, like, he or she is decently functional. He or she is going to work. He's doing things that he or she is supposed to do. Even eating food when they're supposed to eat. Maybe even after they're eating food, they're not gaining weight. This may be a symptom of depression. But that is also a picture of depression. So let's understand that between these two ranges, there can be, depression can be seen at different angles. So that can be there. One extension of depression is that, you may experience depression, and another disorder, which is called an affective disorder or bipolar disorder, is you may experience mania or a manic episode along with it, or let's say in phases, in episodes. But that's a different explanation, and that's a different ballgame. We're not talking about that right now. Today we're talking about depression exclusively, and yes, there can be, these very variations of depression, and as much as I'm trying to make all of you understand the different phases and different ways it can look like, please do not use this video to diagnose yourself or your friends or your close members. Please walk up to a proper clinician to address the concern and to understand what's going on, and do not, misinterpret the information at any point, please.
That was a very informative answer. I'm sure a lot of people would understand better about depression through that. Now, my next question is kind of related to the previous question as well. What are some common comorbidities of depression?
And that's a very, very effective question. That's a very useful question, I feel. Okay. So definitely depression is, it's anyways a very common disorder. 1 in 4 people, according to the WHO, is experiencing depression or has experienced depression at some point in time in their lives. However, many a times, depression can coexist with other disorders, or the symptoms of depression may be subtle or subsyndromal. That's how we call it in our technical term. Whereas the other disorders, like symptoms, are more prominent. One prominent disorder of that matter is substance abuse. Substance use or substance abuse is commonly seen with depression a lot, where there is no manifestation of sad mood or poor mood or not being able to function. The person is dysfunctional because of the substance abuse. Right? This is also like there. And again, this can have range of things, range of substances used, range of different things, where, because it's, starting from which substance is more culturally accepted than which substance. So it depends a lot on those things. But yes, these two are very, very highly comorbid. It's very unique to see these two things, comorbid. The one thing that is very, very prevalent and seen very often with depression is anxiety disorders. It is very common for us to see clients where depression and anxiety is coexisting. It's sometimes so difficult that we have difficulty to diagnose whether they have depression with the comorbid anxiety or depression and anxiety both. So, and we also have a few diagnoses specific for this. They are called mixed, anxiety and depression disorders. So yeah, let's not go into those technicalities. Let's just try to understand and what's going on over there. So, along with the symptoms that I mentioned about depression, there may be some anxiety symptoms as well, like shivering, shaking, sweaty palms, not being feeling breathless at certain points in time. So these are the very basic, commonly seen anxiety symptoms, which may also coexist with depression. And it's very commonly seen, so not surprising at all. There may be other disorders. There may be other very unique combinations that I see these days more and more, which is also adult ADHD. It's very interesting that when someone is not able to focus and pay attention, how dysfunctional they can get, and how all that dysfunction can precipitate into depression. Or let's say an ADHD diagnosis that went undiagnosed, let's say, that may be there. So yeah, that ADHD is also something that can come up. Anxiety I mentioned, substance use, abuse I mentioned. I think that's how we'll wrap up this question.
So now coming on to my final question, I'm sure a lot of people are watching this right now. There's a chance, like you said, 1 in 4 people have depression. So there's a chance some of them do have depression and they're watching this just to have some comfort, just to feel relieved about themselves. So what would your message be to those who are suffering from depression right now?
Oh dear, such a lovely question. I think from the deep down in my heart, I want to tell them that there's someone right now present in this world who understands what you're going through. And one thing is, there is help available. So please reach out for help, because you do not deserve this life. You deserve a life where you're happy, you're chirpy, where you're going and doing things in life. You have, where you're experiencing joy from doing the most simplest thing in your life. That is what, life is. That's what you deserve. That's what is there for you on this planet. And for you to be able to feel that, there is definitely help available in terms of medication, in terms of counseling sessions, in terms of group sessions, activities. So everything is available. Just reach out to the right person, just reach out to the right place. I think that is what you should focus on. And try to do. I know doing that may seem very unrealistic, very not required, or very expensive at this point in time. But please hang around, look at what it's costing you to be in depression, because we have a lot of research that is trying to indicate that depression is very expensive on the whole world. So therefore, reaching out for help and fixing yours and trying to fix this particular way how you feel is possible. And yeah, thank you.
Thank you.